think something we need to really make sure people understand is child rearing and pregnancy outcomes as well. A lot of women who have obesity struggle with their fertility. Much of that has to do with the endocrinology and the metabolic and hormonal abnormalities that come with obesity, things like PCOS as well, which is closely linked to obesity. And one of the most effective fertility treatments involves weight loss when it comes to women who struggle with their weight who are trying to conceive. And bariatric surgery does, in addition to improving metabolic health and weight, many women are able to achieve healthier pregnancies once their weight has stabilized. I have had a number of patients who had previously been through fertility treatments who had been unable to conceive until they had successful weight loss after surgery, and then were able to achieve a healthy conception, carry to term, have low risk of complications from child birth, lower degree of lower risk of cesarean section, and from the baby standpoint, from the development of the child, lower risk of large for gestational age, lower risk for preeclampsia and other pregnancy-related issues. And the nutritional side of things is also very important, because in years past, a lot of people had concerns that you're losing weight, your vitamin levels are changing. Is that going to affect a healthy pregnancy? And today, our understanding of the nutrition, of the vitamin supplementation, we have protocols for pregnancy vitamin supplementation after bariatric surgery. And this allows patients to not only get healthier for themselves, but also to expand their family in a healthy, safe way, where previously their options may have been very limited.
And to add to the other complications with pregnancy and delivery, if an obese patient, for example, has to have a C-section, they have a higher risk of incisional infection, which then puts them at higher risk for having incisional hernia. And so then they have other complications that need to be dealt with later in life. Also, if you look back at the Swedish obese subjects trial, that was a study that studied obese women and the children that they had before bariatric surgery. Follow those children until they grew up. The tendency was for those children to grow up to be obese as adults. Post-bariatric surgery, same women, followed those children until they grew up. They had a lower likelihood of fighting with obesity as adult human beings. So we're helping the entire sort of global health and population health in helping women to achieve a more normalized body weight before they undergo pregnancy, so that they can have a safer pregnancy, safer delivery, and their children can grow up to be healthier.
And that also, it improves the environment for the developing baby. When the hormonal milieu is improved, when the metabolic factors of the mother are improved, that carries through for the child's entire life. So this doesn't just affect one member of the family, it affects the next generation. There's also this halo effect with bariatric surgery, because culturally, in our country especially, a lot of women are very health conscious compared to the men in their family. And so a lot of times the matriarch of the family is the one who's really in charge of everybody's health. They then, if she struggles with obesity and gets treatment, she is also dictating the rest of the family's course and treating their disease. We see all the time, the matriarch of the family comes, gets treated, sees improvements in their lipid profile, in their weight, in their obesity, and then the husband starts coming to follow-ups, starts seeing his weight coming down, his health getting better, the kids start eating better. And so, it's really gratifying that not just are we affecting one patient, it's the whole family unit that seems to see improvements, even if they've never had surgery. I think that's pretty cool.
I see that very commonly, where whoever the member of the family is, whether it was the father or the mother, oftentimes the children we have come in first and then bring their mother back in later, who then sees the mother would have grown up in an era of bariatric surgery, a week in the hospital, 20% complication rate, and these numbers are scary. Then they see their daughter, their son, go through it and do extremely well. And then now they come, like you said, to follow up. Then now they become our patients, or if they're not morbidly obese, but whole families get healthier. And it's such an interesting thing. From kids making better choices for snacks all the way up.
it's also retraining habits. So the person, whether it's the matriarch of the family or a child in the family, if they're getting training, particularly if they're having a supportive family, the rest of the family tends to get healthier because they want to support the patient, they want to support their loved one. If the mother in the family is having bariatric training, have the benefit bariatric surgery, and they have the benefit of nutritional counseling, they're going to be providing healthy meals to their children. They're also going to be teaching their child at a very impressionable age what it is about avoiding sweets, focusing on healthy foods, and just having a healthy relationship with food.
Mm-hmm. So hopefully, as we debunk these myths, we'll be able to reach out to a larger percentage of the population. Because as it stands today, I think we're operating on, at most, 1% to 2% of all patients with a BMI over 40. Not even a BMI of 35 or 30 with medical problems, but a BMI over 40. And hopefully this message gets out to people so that they can actually listen and come in and talk to their physicians and see, is this a good option for me?
For better or worse, obesity is very fraught culturally. And there's a lot of misconceptions, and I think finally the medical community and the lay public are starting to see how treating obesity is not a weakness. It is not. It doesn't reflect on people's willpower or discipline, and we're finally seeing that obesity surgery and metabolic surgery is a treatment, and it's being considered in the same realm as hernia repairs and as joint replacements, as a treatment for a disease process. And when we finally look at it that way, we start to take out a lot of the misconceptions and a lot of the emotionally heavy terms that come with this in terms of preventing patients from seeking treatment for their disease.